Takemi program is a mid-career research training fellowship. We've operated for 3.5 decades, and at this point we have 271 fellows from 54 countries and counting. Takemi fellows had a chance to collect data. They know some things, they have suspicions, but they haven't had the time and space to analyze that information. So they come here, they work with our faculty, they develop new ideas for policy, and they develop the evidentiary base for making decisions. There's a vast diversity of fellows in the Takemi program. Some have come from university service and administration, others are career academics. Some have been at multilateral institutions in global health, others have been in government service. There's no single type of person in the Takemi program.
With about 30 plus years of working in the Indian Administrative Service, I have been largely involved with issues of public policy at the intersection of development, handling subjects of critical importance for India at huge scale.
I have been working for the Ministry of Health of Ethiopia and I have served in different roles. I started my career as the National HIV Program Leader, followed by the Non-Communicable Diseases Program. For a short while I was a Director for Disease Control and Prevention Directorate, and finally just before coming here I was serving as the Director General for Office of the Minister, where I served for 2 years.
In the Takemi team, we've got people from various fields. So we find there are people who are economists in there, people have come from the medical background, people have come as scientists. And when you sit on that table, you can then see that thinking around.
I have been involved in making policy for around 10% of India's population, and that brings with it huge responsibilities.
Just after working in Niger, I was staff of UNICEF, and I was actually responsible for all the polio campaigns that were taking place in the region. And I found that working with the data, you need to have a stronger base. When you're working with consultants, you need to be able to understand the work that they're going to produce and to be able to better guide the work. As a practitioner, I think I had a good technical solid base, but when it came to expressing what was seen in the field, what is seen in the data, I thought I needed to come back to the university.
It is an opportunity to meet very important people here, researchers, scientists from different parts of the world, different points of view, expertise, and it's an opportunity to talk face to face. It's a unique opportunity. My research is not easy, and it's possible because I'm here. I need to focus on my research because my data is a big data. The data contains every records of all students of the basic education in Brazil. We have this data set with almost 100 million students, and it's not easy to handle and to treat such a big data. And here I have all support for that.
More than anything else, I value the chance that I have got to try and improve my own abilities to go back and do a better job.
There's a lot to learn from everybody around you, not only from the books and not only from the courses, but from the people around you. I wasn't really expecting to be tempted by so much candy or so much food, and the diversity of it was quite surprising.
Such a warm environment, a friendly environment. I think that's most important for us. There is a sense of belonging here that's very, very important.
We're discussing on working on projects, and we're thinking of, because this should not end here, we plan to have lasting collaborations after even we leave the program.